Attention chiropractors, slayers of subluxation, unleashers of the imprisoned impulse, and protectors of the developing brain. Welcome to the Cranial Doc Podcast, where we master the work that actually changes lives. Craniopathy, nervous system-based care, and the business systems that let you scale without selling your soul. I'm Dr. Anthony Pellegrino, pediatric chiropractor, certified pediopath, and proud automation geek. Let's dive in. What's up, subluxation slayers? Welcome to another episode of the Cranial Doc Podcast. It's me, Dr. Anthony Pellegrino, and one of the cool things that I love about doing this is that for the past few months, I just have had all of this stuff that I'm like always on the phone about with my friends and telling everybody, and so I started this email series called the Cranial Doc. And you can sign up for free at thecranialdoc.com. It's awesome. And it's information just like what we have in this podcast, which I'm going to talk about in a second. It is AI-based automations, how to write scripts, like software scripts with no coding knowledge to be able to automate your practice, different philosophical things, different craniopathy and cranial information, how to dive deeper into scaling with systems and procedures and technology and everything else like that. And what's really cool about this conversation is that a lot of times I'll send an email, which again, get on that email list. It's awesome, thecranialdoc.com. And then certain ones I'll just get like really amazing feedback on. And what's really funny is that every time that I send that email and I get really amazing feedback on it, I just think like, oh my gosh, there's so much stuff that I want to talk about and include here that I'm not able to, because if I were to put all of my thoughts on a specific topic into an email, no one would ever read it, right? Because it would just be too much. And also the way that my brain works and the speed that I talk, and nothing is ever short-winded. So I do literally like most of my time is writing these emails is taking my notes and editing it down into something that somebody would actually read. But then, I'm like almost chomping at the bit. Like, I want to turn this into 7 emails, but that's just silly. So then somebody was like, well, why don't you just, talk and record you talking about it for people who want more? And I was like, shit, now here we go. The resurgence of, for those of you guys know from the past, the Chiropractic Research Breakdown podcast into the Cranial Doc podcast. And we just get to go deeper into the topics that people get to enjoy in the email series. So definitely get in that email series at the Cranial Doc. But today, what we're going to talk about is a recent email that got amazing feedback. And it's on our day 1, day 2, day 3, day 0 systems specifically for pediatric care. Okay, and this is something that's really important to me. A majority of my practice is pediatrics. I have a diplomate through the ICP in pediatrics, certified spinal and cranial SOT practitioner with Peak Potential Institute and Dr. Marty and Nancy Rosen, who are amazing, and taking craniosacral therapy, just like everything around pediatrics. Oh, PX Doc certified, Focus certified with Dr. Amy Spolstra. So like you name the pediatric thing, and we've really gone into this. So pediatrics is a huge part of me and the doc in our practice. And we, a decade in, I've tried so many different things, so many different avenues to be able to get families to go face down on the table and value the care that we do. And because of that, I found things that worked and haven't. And the process that we have now is just really fine-tuned and super dialed. And in this email, what we discussed is that for every pediatric case, one of the things we do in our office is we require that every initial appointment, consultation, and report of findings is on Zoom. Now, I highly recommend doing this. And people are like, well, what is this? Well, here's the reason, okay? For every pediatric case, there's a couple different really important things we really need to think about, okay? Number one is, I don't know about you, but for me, I don't like talking about a child's challenges or problems in front of them. We have a system, a world that is based around labels. They've been labeled with ADHD, they've been labeled with autism, they've been labeled with all these different things, and everybody wants to put these labels on them. And if they just go to another doctor's office that's treating those labels, which we know in chiropractic is not what we do, it's just another thing. And so the only thing that I want to focus on with that child is the future. What does your potential look like? What are we doing today? What are we doing day to help you move into this better version of yourself? What does this mean? And nothing is about what's wrong with them. Now, that's all beautiful in theory, of course, but of course we still need to know the history. We need to have the challenges. We need to understand. We need to have the outcome measures, okay? And so we still need to go through and do that. And it's the reason that we require that the initial consultation be on Zoom with the child not present. And that's just something that's really important for us. Now, initially, we only did that for our cases that were like, of course, the neurodevelopmental, ADHD, autism, etc. And if we had like a regular pediatric case that you'd assume like a reflux or colic or a breastfeeding challenge, of course, we like brought that family. We just did that consultation in the office. Okay. Then what we were kind of looking at was, well, the couple different questions of, one of the benefits of doing the Zoom consultation with an older child is that not only we're not having this conversation in front of them, but of course they're not like pulling at mom the whole time trying to talk about what's going on. And then, we noticed that same issue was kind of happening even with the baby, right? It's like, okay, so they come in, they're in the car seat, we start the consultation before we do the evaluation, and they're doing really good in there, they're being helped. But then by the time it's time for the evaluation, it's just been like too much time for them, like not being able to do exactly what they want to do, crawl around on the floor or whatever else, and mom like being anxious and too much time just like not being completely about them with conversation. We would go to the evaluation, and then it would just like wouldn't be as great as it possibly could, right? Or they'd be, it'd be really hard for their parent to be able to pay attention during the consultation and actually give good information, set good goals, because, they would be distracted by what's going on and everything else like that. So what we found that, of course, like a baby, parent's not going to give you 100% attention. They're going to be paying attention to that baby. But we just found that by doing every pediatric case on Zoom, it just made our life, having this conversation when they're in the comfort of their home just made everything just so much easier for them. And then from a scalable perspective as well, every time my team would get a phone call or see an appointment, it would be like, okay, so is this a pediatric case? Yes. Okay, so we need to schedule a Zoom. Adults we can do in the office. Okay, but what kind of pediatric case is it? Like, mom, does your child have ADHD or neurodevelopmental issues? No? Okay, cool. Well, then we'll do it in the office. And it just was like just impossible. We came up into so many situations where it just like we should have done something on Zoom and we didn't, or and it's just like we just made the decision to put every pediatric case via Zoom with an evaluation in the office right from the get-go. Okay, so our process looks like this. Boom. Call, make an appointment. If they call, my team knows right off the bat, parents making an appointment for their kid. So they're going to go ahead and make the Zoom consultation and evaluation appointments. The next thing that is possible is I'm going to see an appointment come through our website where somebody books an evaluation. My team's going to see that the appointment's for a child. They're going to immediately call and say, hey, we can definitely do that evaluation here in the office. However, we're going to also schedule the Zoom consultation ahead of time so you and the doctors can talk and go really deep on this. We're not talking about the challenges in front. You can just really pay attention and have your spouse present if you'd like, because it's at home. And we can do this all in the comfort of your home. Awesome. Cool. So we get that right there. So we schedule the consultation and the evaluation. During the consultation, one of the things that we also found, and especially this is for all pediatrics, but almost every parent that is going to be showing up in your office, what we must understand is that they are in a chronic state of fight or flight, right? Like they are in chronic stress. Just parenting is chronic stress. And so because of that, they perceive the world very differently than somebody who is not. So if you have gone through any like day 1, day 2 training, you have somebody come in, you do your full consultation, you do the full evaluation, you tell them that we're not getting adjusted today, and then you schedule the report of findings for 24 to 48 hours. Like that's a lot. Maybe you do the adjustment, maybe not. But if you're listening to this, you're probably doing a report of findings to let the parents know like what is going on, or not let the patient know what is going on and what are our recommendations. And then they can get started with their corrective care plan from there. Okay. Or restorative or whatever you want to call it. That's what the process looks like. Just, of course, in your office, you change the names and faces to protect the innocent, but that's basically what your process should look like. Now with adults, a lot of times they come in, they do the initial evaluation, maybe they get adjusted or not, and then they schedule the report of findings, 24 to 48 hours. They're in pain. So that is something that is like really urgent for them. And then they just schedule that right away. Now, and that's fine. And that way you're like avoiding the things of, you're on the phone and they're like, wait, what is this? I'm gonna have to do this and this. Like, okay, cool, I get it. But like, I just want to get adjusted. I just want to do one-time thing, because they don't have the framework for what it is that we're actually doing. And by giving too much information, of course, we want them to understand the process, but by overloading that person with information, you're actually creating a disconnect with them and less likely for them actually to show up for their appointment and continue on with care. The opposite goes with somebody who is in chronic stress, because lovingly, predictability is massively important. And things that aren't predictive or things that aren't predictable are higher levels of stress. And stress in the situation for them kills their ability to move forward. We think about fight or flight, but the more likely is freeze. When they're stressed, they become paralyzed by the decision and they just can't move forward. So what we were finding in this situation is we would schedule the consultation and we would schedule the evaluation. And then once we had them come in for the evaluation, then we would go schedule the report of findings. And it just was too much. You have this parent that's coming in, they're juggling schedules for 40 different children. And then it was like, okay, cool. We did the consultation, we did the evaluation, and then the report of findings gets booked 2 weeks out or a week out. And it's like, oh my gosh, it's just not a good situation, right? So much momentum is lost. And so much of what you discuss is lost between the day 1 and day 2 and the actual report of findings. That just wasn't a good situation. So what we decided to do was actually take a minute, and when we had that initial intake, we are explaining the process. We are scheduling our day 1, our Zoom consultation, our evaluation, and explaining to them that we're going to go over all those information, all those findings via Zoom as well, to go over everything so their spouse can be there, so everybody can be on the same page, lay out all the benefits of the reason we do that, and they're actually scheduling all 3 appointments before they ever get anything. And then because we have that all scheduled, we're also taking a deposit to schedule that Zoom. We also, in the past, years ago, had situations where, for pediatrics, we actually do all of our consultations is exclusively with our doctor. We don't have our CAs do that, whereas they do have more of a role in our adult cases, the consultations in the office. So, of course, we had situations where, we would do a Zoom, somebody would be all in, whatever, did the Zoom, and then they, for whatever reason, something got in the way, they no-showed the evaluation, or they just, were like, oh, this isn't for me, whatever. And then it's like, okay, well, we just spent 30 minutes to an hour of doctor time with you on a Zoom, and and you don't show up for the evaluation, so we don't get paid. That's horrible. So we took the deposit for the consultation that now gets applied to the cost of the evaluation, kind of like going to a car mechanic and, you put the deposit for the diagnostics, and it actually gets applied towards the cost of the of the actual fix of whatever's wrong. That's basically what we do there, okay? And that just makes it nice and easy. And so during the evaluation, during the Zoom, of course, what we're doing, the most important thing is we are listening to them, we're going through, we're asking them questions, we're setting goals and everything else like that. And once we have everything, it's now our job to be able to build predictability, okay? What we always say, this is a watch and wonder conversation. It's not our job to be able to come up with any answers today, but rather to start to have some specific questions, okay? And when we do our evaluation, we're going to be testing those theories to see if we're moving in the right direction. So we recap every phone call, every Zoom consultation with essentially, hey, based off of what you're telling me, I don't know for sure exactly what's going on here. However, I've worked with so many, and I won't know exactly what's going on until we do the full evaluation, right? You're not just saying, oh, I have no idea. We're going to do the evaluation. We've worked with many children in the past who've had really similar issues, and we've been able to get results. And your story really reminds me of that. So based off of my experience, based off of what you're telling me, this is what I'm curious about. And you're basically going to present what you are expecting to find at your evaluation. Or if you have a couple different working theories, what the potential things that could be going on is. This is something that's massively important for our office, especially when we have a child with apraxia, because there are some different pieces that we want to pay attention to. And if we're looking at something where we're able to see these massive deflections in their developmental milestones, and there's just this big underlying brain development piece, of course, the initial restorative phase of care is going to be something that's stretched out over a much longer time. Whereas if I have a child, and this happens a lot, especially as you do more cranial work, where they're diagnosed with apraxia and we look and they just have wicked TMJ disorder, their jaw is misaligned, big things there. My initial restorative phase of care might be something that's way shorter because I need to make sure that we have that jaw balanced before I have any If it's just simple structural jaw issue and not as much as the developmental piece we found in our evaluation, we'll be able to just do a much tighter care plan there, because what we want to restore, our indicators that we want to clear, are something that clear over a much shorter amount of time. And those are different things that we actually just evaluate and look at when actually care planning. And so I'll let them know, hey, if we see this, then your care is actually probably going to look like this. If we see this, it's probably going to look more like this. And give them just a lot of predictability around that and allow them to ask any questions. Once we go into when we do the evaluation, we just kind of recap what we're looking for. We do the exam, and I'm basically saying, hey, I know, you know how we talked about this versus this? I'm seeing a little bit. I think we're going to be more in this category based off what we find. Let me lay out all my findings, then we'll go into the report, right? And then when you go to the report of findings, the important thing is that you are there's no questions. This is their third appointment with us. They've agreed to that. They have an idea of, based off of what we found, what our recommendations might look like. We already kind of gave them an idea of, based off of what they told us, what we'd expect to find. And then we told them at the evaluation, we found this or not. So again, your recommendations are going to look something like this. We're not laying out this thing where it's like they were expecting to be under care for 2 weeks and you're recommending 3 months of care. Like, that's not the issue at all. It truly is just a report of findings. We recap every single thing that we told them. Now, on the initial Zoom consultation, that's really important, is we take extremely detailed notes. Like, every single word we take in notes, because I think that that's so important. And especially for families who have been a massive mistrust for the medical profession. They have felt as though their mom gut has been brushed aside. Like, we believe moms in our office, right? And I know that you do too. So I want them to know that we hear them. So we are going to repeat back our conversation in as many of their exact language as possible, because I want them to know that we got them, we see things. We're looking through their lens and trying to see what they see. Because end of the day, the best diagnostic tool that we have is that mom. So the more that we can view her child through her eyes, or that child through his eyes of dad, the better it is for everybody. So we go through and recap everything, right? Every little nitty-gritty detail. We go into the report. We go into exactly what we found and how that supports that or not. And then we just simply go into the report of findings. Based off of this, like we discussed, we share a screen and we'll just type it out for them so that they can have a visual, tangible piece. If you're just talking to them, again, chronic stress, it's going to be something that's really hard. I want them to be able to see it while I am telling them. So it's much easier for them to be able to comprehend, right? What are the recommendations? What are we doing during this time? What are our goals? What is the cost? Lay that all out for them. And then it's just simply like, spouse is there. Do you have any questions? Anything else like that? Get it all out on the table. I don't want to do a hard tell me, give me your credit card over the heck no. Like, I'm not trying to play that game with them. It's just, listen, we'll set up your first visit. You just let me know what works better for you there. It's like a no pressure situation, and it's just a win. So when you start actually listening to the people who are in your office, when you start catering your information and the way that you have your processes based off of the way that people process the world, and you're able to deliver the highest quality of care, all of a sudden you have an office that's filled with your people who trust you, who are getting adjusted, who understand why, and with way less pushback. So I hope that this helps you. I hope that you start to implement Zoom consultations at the very least, and I hope that you can start to give your chronically stressed out parents and patients as much predictability as possible. It's way better for you, and of course, the most important thing, it's way better for them in getting their nervous system under control. I hope you guys had a great episode and enjoyed this episode of the Cranial Doc podcast. Again, jump on the free email list at thecranialdoc.com. If you don't, you're really missing out. This is just, me ranting about one of the emails that we've sent on a more philosophical basis. I do send a lot of really tangible, like click this button, click that with screen shares and different things like that. You're not going to be able to get that on the podcast. I'm not going to repeat that information. You got to be on the email list to be able to get it. So we'll talk to you soon. We'll see you at the next episode. Keep slaying those subluxations. Thank you for listening to another episode of the Cranial Doc podcast. I hope you got a ton of value out of today's episode. And if you did, It would mean the world to me if you jumped over to iTunes or your favorite podcast player of choice and subscribed, rated, reviewed, and shared this episode with a friend that you know could benefit. We have a ton of this information and more in our free email series at thecranialdoc.com. So go ahead and jump on there, subscribe, and get me raw, unfiltered in your inbox every week, changing your practice. Can't wait to see you for the next episode.